All right, good afternoon, everybody. Good to see you, and good to see everybody wearing their masks of different shapes, sizes, colors, and makes, but everybody has a mask, and it's good to see. We should all be doing that every opportunity that we have. We should be doing it every time that we go out into public and are around other people where there's not a significant amount of distance. So now that we are all nice and well spread out, I'm going to take this off. We have a couple of important announcements to make today. We're very fortunate in the city of Hartford to have three outstanding hospitals and hospital systems that are providing world-class care and that have been treating and caring for those patients who have shown up with symptoms of coronavirus. They have also been working creatively and quickly to be at the cutting edge of treatment and care. And today we have a significant announcement in partnership with Trinity Health of New England, that Trinity Health of New England, which runs St. Francis Hospital right here in Hartford's Asylum Hill / North End neighborhood, is one of only 4 hospital systems in the entire country that has been approved by the FDA to participate in a trial program to provide treatment to coronavirus patients using the plasma from patients who have previously tested positive and recovered. I'm going to turn it over in a minute to Dr. Edie, who is the president and CEO of Trinity Health of New England. But again, just to stress what that means, this is a trial that will allow the plasma to be used from those who have already tested positive, who have recovered, where time has passed, who have then tested negative again, and allow their plasma to be used in the treatment for those who are suffering most acutely in Trinity Health's care and in St. Francis' care. We are tremendously proud of St. Francis and Trinity Health in New England. We're tremendously grateful to them as well. And I think it's a great thing for our state and for our community that they have the opportunity to participate in that trial. I also just want to take a minute to say, I've talked about this a few times recently, and the governor spoke eloquently about this issue yesterday, and there's been a tremendous amount of coverage, which is good to see, of the really troubling disparities that are beginning to become evident, both in the incidence and the outcomes related to coronavirus. We are seeing communities of color disproportionately hit by the coronavirus. And a number of people have talked about the reasons for that, whether it's the prevalence of underlying chronic conditions, whether it is population density and the higher levels of intergenerational living or apartment living, or whether it's the fact that in many communities of color, we've got a lot more folks who are doing those essential jobs that we are all depending on, whether it's the grocery store workers or healthcare workers or bus drivers or DPW workers or so many other jobs that are continuing to be done, and where workers are continuing to put themselves at risk for the rest of us. And I want to stress that for 2 reasons. One, as I said yesterday, we want to make sure that our community does not get complacent. No matter what we see anywhere else, we've got to stay focused, and we've got to stay disciplined, and we've got to look out for one another by doing our part. But the second thing is that we're lucky to have hospital systems and healthcare providers that are very focused on that disparity as well. And so I'm going to ask Dr. Edie to speak a little bit about what Trinity Health of New England and what St. Francis is doing to care for our community and to respond in advance, respond in real time, to do everything possible to minimize those disparities. And finally, let me just say, again, we're very lucky to have great hospital systems, but also very lucky to have great partnerships with those hospital systems. And so to all of the healthcare providers out there, from the administrators down to the doctors, to the nurses, to every single person working in our hospitals, in our healthcare systems, to care for patients who are showing up, to put themselves in a position where they may potentially be exposed so that they can care for others. Our entire community is deeply, deeply grateful to you. And again, it's with both pride and gratitude that I turn it over now to Dr. Eady, President and CEO of Trinity Health of New England. Dr. Eady, thank you very much for your partnership, and over to you.
Thank you, Mayor Bronin. So first of all, let me say thank you to Mayor Bronin and his administration. They have been tremendously supportive to not only Trinity Health New England, but all the hospitals. And thank you for the efforts that you put forward to make sure that your community lives safer and longer lives. In addition to that, I'd like to thank the community. I mean, you guys have been tremendous in showing appreciation to the healthcare professionals in the state of Connecticut. The men and women that I have the pleasure of working with every single day put their lives at risk to go to the line and ensure that high quality and safe care is provided. So I want to thank all of them in the community for recognizing them. When you think about the social determinants of health, access came to mind immediately to me and my team. When you think about COVID-19 and the healthcare disparities that we're seeing in many minority communities, we sort of scratched our head and asked ourselves the question, what can we do to fulfill our mission and play our part? And we've done a lot. We've got drive-through testing. You can walk up to our drive-through testing. The testing is available at every single one of our hospitals. And so we're doing our part. But then we thought to ourselves, there are people who can't access our drive-through testing centers. So we came up with this notion of a Fury Clinic. And what this is, it's a fever and upper respiratory infection clinic. We are erecting them throughout the state of Connecticut. The intention here is to create a triage system, if you will. We don't want our community members who have symptoms such as fever, cough, or shortness of breath to necessarily go to your doctor's office or to the emergency department, because clearly those aren't the very safe place for you to go to. But nonetheless, we will, through our website, and a number we will provide on our website, we'll set up these clinics for you to arrange or make an appointment for a teleconference or a telemedicine opportunity so that we can provide through a professional provider all the support you need. So we don't want the community to be anxious. We're here for you. We will give you a prescription through that appointment if it is necessary. And if we're not offering the testing at that Fury Center, we will certainly have one available near your community. So we're going to continue to do our part as we look at the fundamental issues here, which include the social determinants of health. Yesterday was an amazing day for Trinity Health New England. When we got the news from the FDA that we, along with 3 other healthcare systems in the country, are going to be the fourth to provide the support through these so-called convalescent plasma treatments. So to talk a little more about that, I'm going to ask my colleague, the expert, Dr. Dulupsi, to come up and sort of explain what that looks like and how beneficial we think it will be to the community.
So yesterday we got approval from the FDA to conduct a clinical trial to study the safety and efficacy of convalescent plasma. Just to give you a little background about convalescent plasma, this has been used since the 1890s when people have used convalescent plasma for the treatment of infectious diseases. As recently as about 10-15 years ago, we have research to prove that it actually works in viral infections like SARS, MERS, and H1N1. But what drove us to do this is about 10 days ago, there was a paper that was published from China that used the convalescent plasma on 5 individuals, and 3 of them actually did very well and went home. And then subsequently, on April 6th, there was another paper that came out with 10 individuals that used convalescent plasma, and 7 of them did very well. So we have been granted approval to study the safety and efficacy at our centers at Trinity Health of New England. Say that? Oh, the end result is to use this product in individuals who are critically ill and hope that they are able to mount a response, because right now they are unable to mount a response. The science behind the plasma, convalescent plasma, is individuals who've already been affected by the virus have mounted a response. So what we'll do is collect the plasma, the blood from these individuals, and then make sure that they have the right amount of antibodies, and then give it intravenously continuously to the recipient who is currently sick with COVID-19.
So the testing, are you trying to figure out how many antibodies? Is there still a question about whether or not this will work with the coronavirus? I mean, what exactly are we testing?
Excellent question. So right now, this project is efficacy and safety. So we want to see whether, we are looking at the antibodies and we're going to decide there is a cutoff for the antibodies before we transfuse it. But then we also want to know if it is safe in individuals who receive this.
So as a layman to understand this, you're studying the antibodies from somebody who has recovered from it. And if you find the correct number of antibodies in the plasma, you would use that to treat somebody who has it. Could you use a blood test from a person to find those antibodies to find out if a person is resistant and might not contract it?
Yes.
So if I'm not sick and you took a blood test and you found the antibodies in me, you could declare that I am now resistant to them.
So if you have the antibodies, it means you mounted a response, and that's all we're looking for. So you need to currently be COVID negative. You should have had a history of a positive test about 30 to 45 days ago, but currently you should be symptom-free for 2 full weeks and should be negative before we actually draw your blood. Then we'll analyze to see if there's appropriate antibodies before we transfuse it to the individual.
Would it be possible to test somebody to find the antibodies?
Yes.
Even though they did not test positive for it?
I'm sure you can, but we are the way the study is written is we are only going to start checking antibodies on individuals who have already tested positive and we have a confirmed result.
But does that show potential for a test that can come up in the future where once we get done with the backlog and we flatten the curve?
Yes.
If you tested my blood and you found I had the antibodies,
Yes.
could I be healthy and resistant to it?
So it just means that you've been exposed to it and you mounted a response. As far as whether you're resistant to it, meaning whether you'll get it again, I cannot answer. I don't know.
Can you tell us when the first patients with pancreatitis might have the plasma transferred?
We are hoping to start screening donors tomorrow, and hopefully by the end of next week, we should be giving the first transfusion.
You kind of touched on it, but what's the timeline of somebody who's tested positive for COVID-19, then to be deemed recovered, and then drawing the plasma to now doing next week getting it to patients?
Yes, so we want them to have been tested positive, and they should be currently 2 weeks symptom-free. And thereafter, we will screen them. There are a couple of other criteria for eligibility. And if they fit all those criteria, then we will check to see whether they are COVID negative currently, then draw their blood for antibodies, and then harvest them for the plasma collection.
So you could be looking at roughly a month.
No, not at all. We are looking from the day we identify the donor, the testing, which we will turn around anywhere from 12 to 48 hours, and then the blood bank from the time we get the plasma, and then they identify that this individual is actually suitable to give the blood. Just like with any blood product, we have to do all the appropriate tests to make sure there are no communicable diseases, and that takes another 3 days. So it's about 7 to 8 days from the time you identify a donor, at least the way we are doing it.
With Trinity Health doing this test, is it only being done in St. Francis, or because it is a health unit or a co-op consortium, however you want to describe it, group hospitals? Are there other hospitals that are doing this testing?
So we've been approved for the trial to be done in all the 5 of the Trinity Health hospitals. And do you want to talk about that?
Sure. So we try to do everything as a region. And so the intention here is to offer this passive immunity to all of the Trinity Health New England facilities.
Do you have any idea how the other 3 hospitals have done with this for the 4th to get it? Has there been any outcomes for the other 3, or the all 3?
I personally do not. Latham may know, but what I do know, and I think she alluded to this earlier, is that when we looked at studies, that there was one that came out in JAMA a couple of weeks ago, and there was a study out of China just last week, and it showed very favorable outcomes for patients there who were given this passive immunity.
So I believe that Johns Hopkins has got a trial approved, so has Mayo. Mayo also has an expanded access program where you do not have to participate in a clinical trial, but if a provider feels that the patient may benefit from the the convalescent plasma, they can reach out and register to that expanded access program and get the medication, get the convalescent plasma as well.
The studies in China, do we know the seriousness of the cases for the patients who received it? I mean, are we talking patients who were either on ventilators?
Yes. They were either moderately or severely ill, and we have certain criteria. Yes, there are some definitions for that.
And once these hospital groups get done with the test, how fast would it be assumed that other hospitals could share this information and start doing the same treatment?
So we are going to share our information as soon as we collect the data on about 10 to 15 individuals. And then I think it's up to other places to, this is just a phase 2 trial. It's got to go to phase 3. Or if the FDA decides to approve it as a treatment, it's right now not approved as a treatment option. It's in trial.
Are there any risks to this trial from a donor standpoint and to those receiving the plasma?
So from the donor's standpoint, the risks are needle stick, we are sticking them for blood. Maybe there is a very, very small chance that we may be exposing them to COVID-19. So that's the risk on the donor side. And on the recipient side, as with any blood transfusions, you worry about congestion of the lung, overloading of the heart, reactions to the blood transfusions. So those are some of the side effects that, but we will be, the safety and monitoring board will be checking on adverse events throughout the study, and we will be checking all these individuals from day 0 of receiving the convalescent plasma.
And I would add that, these are very critically ill patients. So I think it's clear that the benefit outweighs the risk. And that's why we think that it aligns with our mission at Trinity Health New England, and we think it's the very right thing to do.
Do you think it'll be helpful now that we're coming out of the flu season and heading into the warmer season? As we flatten the curve, now you can really get some more work done and some more research done, because we're going to go back into cold flu season in 6 months.
So that's what we hope. But unfortunately, we don't know that that's the case. So, and Latha can weigh in, but, my research suggests that unlike the influenza, the flu virus, which flu season, as you know, is from October to March, the reason why it ends in March is because the temperature increases. There's more sunlight, there's more humidity, and it creates an unstable virus. What we saw in U.S. and parts of Florida and other parts of the other parts of the globe that were at that time in the summer, we saw that the virus remained virulent or it remained stable. So we're hoping that we see a flattening of the curve and a positive impact from the warm temperatures, but we're not really sure that that would be the case.
How much blood do you need for a mass scale? So you have one patient who's a donor. How much blood can they give? Can they keep giving over days? And how many patients can they treat?
So for a plasma, to receive plasma, you go through a machine called an apheresis machine. They take your blood, and then they just take the liquid portion of your blood and transfer all the cells back into your blood. So we are hoping to get 1 to 3 units from each donor. A unit is about 200 cc's or ml of the plasma, just the plasma. And also, just like Dr. Edie was saying, people are working towards developing a vaccine, but until that time, this is more of a passive immunity that we are trying to provide. You can scale it. You can pool the plasma, but we are only going to go with one at a time because we are studying this process. This is a clinical trial, but eventually you can pool plasma, just like if you were to get plasma for any other condition, it's usually pooled.
To that question, if we're able to scale this out, can you donate plasma more frequently than you can with regular blood?
Yes. I believe the plasma can be donated more frequently. Again, I'm not very sure as to how frequently, but it's not the 6-month time period. Yeah.
No, I have no knowledge of any issues that we're having. I mean, we are fortunate to work with amazing young men and women who despite the climate, The drive-throughs are open, and they're caring for patients in the community like it was an 80-degree day in the summertime. I mean, no complaints from our colleagues, and they're doing an amazing job. So to the extent where you guys can join us on Friday, we have something called a tribute train, where we're going to dedicate time to all of our colleagues at all of the Trinity Health New England facilities. I mean, that would mean so much to them, because without them at the front line, we don't have people to care for the community as relates to not just COVID-19, but remember, we canceled elective cases, so there are other people in the community who also need some support, and it's the men and women that we work with that provide it every single day.
You said there were 3 or 4 other locations where this testing is going on around the country?
Yes, so it's Mayo Clinic, it's help me out. It's Mayo Clinic, it's Johns Hopkins, and it's Mount Sinai in New York. Thank you.
Was one of the reasons that Connecticut was picked because we are considered a hot spot or right next to a hot spot?
So I don't know that answer. Lathan, you want to?
So based on the 2 studies that came out of China, it was a decision of the hospital to pursue a clinical trial so we can offer this to our patients.
On the issue of disparity, what is the city doing or St. Regis to get some of this information out to some of these residents who might need to go to a clinic if they don't have access to a doctor?
So first of all, I want to say, as I said earlier, we're fortunate to have healthcare systems and hospital partners that are focused on this issue, and whether it's, as Dr. Edie said, making sure that drive-through testing doesn't mean you can't get tested if you don't have a car, right? That's an important thing. The drive-through testing was set up so that you could minimize exposure of healthcare professionals, but we got a lot of folks in our city who don't have vehicles, and so you can be tested without a car, walking up to. That seems like a small thing, but it's actually a pretty big thing. The clinics that they're talking about setting up is another very welcome contribution to that. I think what I want to do now and ask for your help in the media, and I'm grateful for it, is just to get the word out there. These disparities are real. They are significant. And I said this yesterday, but as news comes out of certain cities nearing their peak or nearing plateaus, that does not mean that we can let down our guard. And we all have to continue to take social distancing very seriously. It also means, as we've talked about before, please don't think about just yourself. If you're going to the grocery store, think about those grocery store employees, those grocery store clerks who got to go back to their families, got to go back to their homes, and stay 6 feet away. Wear a mask when you go to the grocery store. That makes a difference. Our bus drivers are out there continuing to operate, and thank goodness they are, because we have so many people who can't get to their essential jobs without public transit. And it's important that those bus drivers continue to get the PPE that they need, the protective equipment. But also, if you're riding the bus, give them some space, stay far away. Those simple things really can make a difference. So we're trying to get that word out, and as best we can, make sure that we continue as a community to recognize just how seriously we have to take this, that not only is no community immune, but we've seen some pretty troubling disparities across the country.
Mayor, what are you doing for the minority community in Hartford that may be disproportionately affected by COVID?
So I think that's the same question, and again, it's partly partnering with our healthcare providers to make sure that they are ensuring equal access to testing, that they are conscious in the beginning about the disparities in outcomes in the coronavirus. Again, one of the reasons, one of the theories of the disparate impact, the disparate outcomes, is the prevalence of underlying chronic health conditions. And so recognizing that from the start and making sure that patients are getting the treatment that they need from the minute they walk in. We're lucky to have great partners who are focused on that. Aside from that, the most important thing we've done and we can continue to do is to try to keep apart, physically apart, take social distancing seriously. Again, we're doing everything we can on the city side and the government side to, A, require it, to enforce it where we have to, but also to make it workable. And that means making sure that we are doing everything we can to get food out into our community, making sure we're doing everything we can to deliver meals to seniors who we want to isolate, and we don't want them to have to go out to the grocery store. Those are some examples of the things that we are trying to do and need to continue to do. Sure, yeah, please.
So I think the original question to the mayor was, what has he and his administration done? Well, I can tell you he's done a lot. Yesterday we received a call after it became a very hot conversation about the disparities amongst African American from the mayor himself, asking us, or holding us accountable, what are you doing, Trinity Health New England, to ensure that this population is well taken care of? And so our response to the mayor was what we've done in the past, and that is we've done multiple webinars, which I'm sure you guys have seen, where we educated the communities. I personally went on, this is before the churches were closed, went to a number of churches in the city of Hartford to educate the congregations on things like how to wash your hands properly and social distancing. But that's not enough. I mean, clearly it's not enough, because we have been doing those since the outbreak hit the state of Connecticut. So there's a lot more to do. So we're understanding how we can better educate the community to let them know that even though you live in the socioeconomical space that you do, there are things that you can do to mitigate the spread in your respective communities. So we will continue to take this on as a Trinity Health of New England. St. Francis is right in the heart, I think, of what the mayor is faced with, and we are happy to take this on as a partner with the mayor and the state of Connecticut.
I understand there's some workers at Francis that are still looking and have had some trouble finding some housing. They don't go back to their homes, essentially close their families. What's the availability right now for a nurse who's trying to find a dorm or a hotel?
Yeah, I cannot get into details, but I was being briefed prior to coming here through our Regional Incident Command Center. And what I can tell you is that there are multiple universities and multiple hotels that we are making available either free or at very discounted rates for our colleagues.
Mayor, was it Newport, or do you know Newport had offered dorm space?
So the question was about the UHART dorm space. As you know, the city has entered into an agreement with UHART to house just about 200 of our employees. That's primarily first responders, firefighters, police officers, those who are staffing the hotels where some of our homeless community is now staying, and others whose duties may take them more often into contact with folks who might have the coronavirus, or whose jobs mean they can't avoid that contact. We have offered to partner with both of our big hospital systems to try to expand that. I think UHART is very willing to do it, but I think, as Dr. Eady said, there are a number of direct relationships between hospitals and either hotels or universities, but we stand ready to help any way we can. And I know that the University of Hartford is willing to do as much as they possibly can do and as much as they're asked to do.
Because I think Trinity also wants for Hartford Hospital.
Yeah, that's right. I also know that Hartford Hospital has entered into an arrangement with at least one hotel, and I think more than that.
Why, Dr. Mee, why is there a lag then for Trinity Health or St. Francis that there haven't been announced hotels or partnerships that there would be somebody even today trying to go to find someone?
Yeah, so the one thing about Trinity Health New England is we don't necessarily try to make public or brag about the great things we do to the community. It's just our mission, and we don't see it as we're not a competitive organization from that sense. But we've sent multiple emails from my office, and to the extent that there's validity there, we will continue to do it. But we have sent multiple emails to our colleagues, because that's what we want to communicate to ensure that if there's any sense of insecurity around them returning home, that we've got their backs, we're their partners, and we will make sure that they know that there's an alternative place for them to go to. Thank you for that.
We've also wanted to just check, is there any more information I can know about any furloughs that you guys can talk about?
I'm sorry.
Can you tell us what it is bring an update on furloughs?
Yeah, so I mean, like every organization in the country, and we hear the president, the governor, and the mayor talk about tough times every single day, we need to make sure that we maintain viability as an organization. right? And so we're known for our value proposition, which means we've got some of the highest quality in the state and the lowest cost. That's just who we are. It's our mission. So with that, we have to figure out a way to make sure we manage our expenses accordingly. And we're still deliberating over what that looks like and how we would do that now.
Is it possible, or how difficult is it for organizations like yourselves? We just covered the grand opening of the Joint Replacement Center across the street at Hartford campus. They obviously are not doing anything right now because of all elective surgeries are down. The nurses, the technicians, everybody that works there, while they might not have specialties, can they be transitioned into the hospital in other locations as support?
Absolutely, and that's exactly what we do. So we have a redeployment program at Trinity Health in New England. So I can tell you that, we take temperatures when we walk into the building every single day. And the young lady who took my temperature this morning was wearing her CJRI name tag. So she, in your example, was someone who was deployed to a different part. I mean, we've got a skill set that we don't want to lose. And so, from a surge essential and bedside essential standpoint, we are certainly doing the best we can to hold on to the talent and the skill sets that we have. If I can make one last final comment, if you will. So here's what I'll say. To Southwest Massachusetts and Connecticut, where Trinity Health has its scope of responsibility, you should be rest assured when you have mayors like Mayor Bronin and our governor that you guys are going to be okay. We'll get through this. We just need to put our heads together, continue to hold us accountable as the mayor is doing. And I have no doubt that in partnership with the great healthcare systems we have here in Connecticut and at Trinity Health in New England, we'll be just fine. So we're here if you need us. TrinityHealthofNE.org is our website. On that, you can understand more about how to utilize our Fury clinics. We also have the community hotline. We have clinical people that will answer any questions that you may have. And I just don't want the anxiety to be where it has been. This is where we all come together, Hartford and Connecticut strong, and we get through this. So God bless you all, and we're here. Thank you.
Thank you very much, Dr. Eady, and thanks again to your team. And thank you again to all of the healthcare providers, all the healthcare professionals that are out there doing their vital work every single day. We're so grateful to you and grateful to the partnership. Stay healthy, everybody. Stay physically apart, but stay connected with one another. Call those you love, and God bless. Thanks, everybody. Take care.